Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about respiratory tract infections and something that shouldn't come as a big surprise, but a simple supplement that reduced upper respiratory tract infections in exactly the population that we're worried about. So, in case you've been hiding under a rock for a very long time, the big concern with the pandemic and COVID is the respiratory infections and the damage that it causes to the lungs, especially in our older population and in the obese population. There are other things that play a role, like elevated blood sugar, but it is very clear that elevated BMI and elevated age creates a bad combination for COVID. So it would make sense that if we did something that was safe and effective and completely made sense, that we should be using it, right? Well, that's not always the case. We are just desperate to find a drug or something that is brand new or expensive that we can use for this. And gosh forbid we should try to do something that actually makes sense. And that would be building up our own defense systems, and not just the immune system, because that's a whole nother topic altogether, but our bacterial warriors that we have already living within us. They are very territorial. So I consider it as a giant game of King of the Hill. So when we have a good, healthy gut microbiome or skin microbiome or respiratory tract microbiome or oral microbiome or urinary tract microbiome, these bacteria, when they're working for us, can keep other things at play. That is very well accepted. There is no question that having healthy bacteria keeps other stuff at play, regardless of the area that we're talking about. So it should be no different with the lungs and the respiratory tract. So this concept is called the gut-lung axis. So we know that there's connections between the bacteria. They may not be as direct as the oral lung pathway, but the gut bacteria and the lungs, they play a role. So we don't necessarily have to directly sniff. I can just see it now. You pour out your probiotic, you do a little line on a mirror, and you just snort it up your respiratory tract. We're not talking about that, even just oral. And so when I talk about the microbiome, I talk about a lifestyle that is constantly fostering the growth. So different fibers, different phytochemicals in the spices and the herbs and the berries and things that we eat in this huge package. So just probiotics, this simple approach, is a very basic way. And if just the probiotics are effective, which we're going to get to in a second, what happens if we focus on the entire microbiome, which has been completely absent this entire year, which is a whole nother discussion. But this is a particular trial looking at 220 people that were taking probiotics for weight loss. Now, the weight loss was successful, but they also happened to look at how we could, if these had any impact on upper respiratory tract infections that were reported by the participants. And the probiotics in particular were 50 billion colony-forming units, so it's a pretty strong probiotic. And they found that there was a 27% reduction in upper respiratory tract infections in as early as 2 weeks. So, I don't even know what to say to that, other than, why didn't we say this long ago? It's because we were looking for some expensive drug or some brand new technology that people, they like new, cool, shiny stuff, and they don't like the old stuff because the old stuff can't possibly work because we're still on the planet. But anyway, that's an aside. And what was interesting is that the people that were most protected were those that were over 45 years of age and over a BMI of 30. So the exact freaking population we want to protect was better protected with probiotics. Don't know what else to say other than we have taken the completely wrong approach to COVID this entire time. And to date, a year later, we're still not talking about lifestyle changes and targeted supplementation that has very little downside. years and decades of tract exposure and use. And anyway, as always, I will post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs information, and subscribe to the channel.